Cranium Bones, RAD 310 Sectional Anatomy, Bachelor of Science in Medical Imaging Program, Instructor Chris Gibbons. Sectional imaging of the cranium may be utilized to evaluate the extent of blunt and penetrating trauma, examine for masses, or aid in the specific diagnosis of bone diseases, such as osteomyelitis or Paget's disease. In CT images, the window can be adjusted to demonstrate the bone or the brain, and both are of interest in many sectional imaging procedures of the head. The screen image here demonstrates a comminuted and depressed fracture of the lateral aspect of the frontal and right parietal bones. Notice the air density superficial to the bone fragments, which is called subcutaneous emphysema. There's also fluid density in the frontal sinus. That's another result of the trauma. The anatomy of the cranium is going to be presented in this media module. An effective method to approach the study of anatomy is to pay close attention to the relationships of bones of the cranium from anterior to posterior, medial to lateral, and superior to inferior. It'll also be useful to recognize unique bony characteristics of each cranial bone, such as which ones contain air cells or sinuses, and other unique architecture, such as the petrous ridges of the temporal bone. This will allow you to create landmarks to help identify where you're at. The key is to have a persistent, organized, and systematic approach that will help benefit your mastery of sectional anatomy, the way that you approach each image that works for you to help identify your location and the anatomy contained within that particular slice. The objectives for this media module are 1. To identify the bones of the cranium, including their prominent landmarks. 2. Locate and identify the sutures of the cranium. 3. Describe the structures and functions of the ear. 4. Cite the name, location, and purpose of the fontanelles of the infant skull. And then 5. Identify all pertinent anatomy on sectional images. The skull is divided into cranial bones and facial bones. There are 8 cranial bones and 14 facial bones. As you study this anatomy in 2-dimension diagrams, try to imagine them in overall 3-dimensional shapes of each bone and its relationship to kind of the other bones in the skull. This practice should enhance your ability to recognize the cranial bones on the sectional images that we'll go over later in this media module. The frontal bone, as its name suggests, occupies the anterior portion of the skull. Note the location in this diagram featuring the anterior view of the frontal bone. The inferior and anterior aspect of the frontal bone has 2 palpable ridges called supraorbital margins. At about the midline of these margins there is a small little hole, the supraorbital foramen. Just inferior to the supraorbital ridges there is a piece of bone termed the orbital plate. In the midline between the supraorbital margins there's a slight raised prominence called the glabella. Below the glabella is a prominent nasal spine or a pointed nasal spine. On the lateral aspects of the supraorbital margins, the zygomatic processes are the portions that articulate with the zygoma facial bones. The frontal bone also features the paranasal sinus, which varies greatly in size and shape, but is usually located on both sides of the midline of the glabella. The parietal bones are located on each side of the midline at the top of the skull. Each parietal bone articulates with one another medially, the frontal bone anteriorly, the occipital bone posteriorly, the temporal bone inferiorly, and the sphenoid at the anterior and inferior ridge. The ethmoid bone is located in the midline of the skull, with only a small portion visible on the interior margin of the orbit. The prominent features visible on the superior view include the cribriform plate, which is punctuated with numerous little holes or foramina for the transmission of olfactory nerves. At the anterior end of the cribriform plate, there is a spike called the crista galli, which is also seen on the other 2 views. On the lateral view, note the oval-shaped orbital plate, which is the colored visible portion on the skull outline that we saw earlier. In the midline below the cribriform plate, the long, thin portion that is the perpendicular plate, flanked on both sides by the superior and middle nasal concha. The air cells of the ethmoid bone are located on both sides of the cribriform and perpendicular plates. The sphenoid bone is displayed from the superior aspect, with the skull outlined to its right, demonstrating the portion of the sphenoid visible on the external surface. On the superior view, and about the middle, there's a small depression called the sella turcica, which houses the pituitary gland. The lesser wings are on each side of the anterior aspect, while the greater wings are inferior and larger. The posterior view of the sphenoid bone is displayed with the skull showing the inferior aspect of the skull, or skull base, with the sphenoid featured in orange. The posterior view labels the body in the middle of the greater and lesser wings, inferior to the sella turcica. The sphenoid sinuses are located within the body. Hanging down on each side of the body in the posterior view are two unique structures called the pterygoid processes. Temporal bones are paired, and each is located on the lateral aspect of the cranium, inferior to the parietals. The temporal bones house the organs of hearing and equilibrium and are under the thick internal ridge called the petrous pyramid. Externally, there are several features to note. First, the palpable mastoid processes just posterior to the external auditory meatus. Above and extending anteriorly is the zygomatic process, another palpable portion that joins with the zygoma to form that prominence of our cheekbones on our face. Below the zygomatic process is a small fossa that receives the mandibular condyle to form the temporal mandibular joint, or simply the TMJ. The TMJ is the only movable joint of the head. And finally, there's a thin spike of bone extending from the inferior aspect, the styloid process. The last cranial bone to study is the occipital bone, which occupies the posterior aspect of the skull. Its most notable feature is the large opening, the foramen magnum, which transmit the spinal cord from the brain to the vertebral column. There's also a prominent bulge just above the foramen magnum, termed the external occipital protuberance, or you may hear it called the inion. On each side of the foramen magnum, there are raised facets, the occipital condyles. These condyles articulate with the first cervical vertebra to form the atlanto-occipital joint. The organs of hearing and equilibrium are located very near each other under the protection of the dense petrous pyramids of the temporal bones. The ear is divided by location into three compartments: the external, the middle, and the inner ear. The external ear is the portion that is visible and consists of the auricle and the tympanic membrane, or also known as the eardrum. The tympanic membrane divides the external and middle portions of the ear. The middle ear is also called the tympanic cavity. In addition to the tympanic membrane, the auditory ossicles are also located inside the middle ear. These small bones, named the malleolus, the incus, and the stapes respectively, vibrate in response to sound waves received at the tympanic membrane and transmit these sound waves into the inner ear. The auditory or eustachian tube communicates between the middle ear and the nasopharynx and the mastoid atrium. The inner ear contains structures of equilibrium which consist of the vestibule, semicircular canals, as well as the cochlea. The sutures of the cranium are actually articulations, though they're immovable, between the cranial bones. They have specific names. We're going to go over 4 of the basic ones here. First, you have the coronal, which is between the frontal and parietal bones. You have the sagittal, that's along the midline of the skull between the 2 parietal bones. The squamosus, which is between the temporal and parietal bones on the lateral sides. And then lastly, the lambdoidal, between the occipital and parietal and temporal bones. Here is a 3D CT reconstruction of a somewhat oblique view of the skull. What's nice about this particular view is you can see the sutures, some of the basic sutures very well, such as the lambdoidal suture, a little bit of a view of the sagittal suture in there, and the coronal suture is a nice view of that one as well. But take a moment, work your way around this image, studying some of the other structures that are visible on the exterior portion of the skull. In this axial cut, you can see the lambdoidal suture pretty well, located toward the posterior section. The squamosous, a little bit more difficult, harder for most folks to see. Quite frankly, if it wasn't pointed out, I probably would not be able to find it myself in this particular image. But it gives you a general idea of the location of where that would be in an axial cut, going right through the orbit of the eyes. In this axial cut, a little bit superior to the one that we viewed previously, again, the lambdoidal suture, pretty easy to see. Coronal suture, not so much, but it is there. And the squamosous suture, also visible to the trained eye. You can also see the diplo, which is that material located between the hard shell-like portions of bone within the skull, visible as kind of a spongy black line. The infant skull, as we all know, has soft spots. These are actually sutures that have not yet fused into fibrous and movable joints. These are termed fontanelles, and the purpose of them is really to allow for growth. There are 6 fontanelles named. There's the anterior, also known as the brygma. The posterior, also may be called the lambda. The posterior lateral may be called also the mastoid, and the anterior lateral with the alternative name of sphenoidal. The posterior fontanelle, the lambda, and the anterior lateral fontanelles are the first to close right around 1 to 3 months of age. The others close much later, around 2 years of age. Here is a nice 3D CT of a 17-week-old. You can see here that the anterior fontanelle is very visible. Coronal sutures are just huge in these young children. So just take a moment, study those structures around this infant skull. Notice how vastly different they look from the normal adult skull. Let's take a few minutes and look at some more sectional and 3D images of structures that we've already introduced earlier in this module, just to reinforce some of the concepts that we have learned. This is an image, a 3-dimensional image reconstruction, CT, of a lateral skull. The cranial bones and sutures are really well demonstrated in this one, and the image is wonderfully labeled. I would recommend that you kind of work your way around this image, studying the structures, especially, they got the location of the sutures in there, and some of the major facial bones, which we'll go over in the next media module, and also the bones of the cranium are clearly labeled here as well, the lateral aspect of those cranial bones. So take a moment, pause the video here, and do take a brief study of these structures. This is a coronal CT image of the frontal bone. Notice the air-filled sinuses very clearly at the midline, and the supraorbital foramen that are visible on both the supraorbital ridges, and the one on the right side which is labeled for us. In this axial CT image, and again within the bone window, shows many of the features of the sphenoid, ethmoid, and temporal bones. You kind of see we have a lot of different named features here. I would again spend a few moments, pause the video, work yourself around these, looking over at least all of these 15 major structures here. One of the structures not labeled in this particular image is at the bottom. It's the internal occipital protuberance. It is seen pointing towards the interior of the skull. But again, spend some time and go over the other 15 identified parts. This is a coronal CT image demonstrating some of the features of the sphenoid bone. Most noticeable in the center of the image is the sphenoid sinus. Above the air-filled sinuses are 2 small points of bone, the anterior clinoid processes. Inferiorly, the unique pterygoid processes are seen just deep to the mandibular rami. Bilaterally and superficially, a very small piece of each zygomatic arch is also demonstrated. This is an axial CT image demonstrating features of the ethmoid and sphenoid bones. Anteriorly, the cribriform, and superiorly, the ethmoid air cells are demonstrated. The sphenoid sinus is also labeled midline posterior to the ethmoid. The anterior and posterior clinoid processes of the sphenoid are also seen in this particular image. This is an axial CT image below the level of the orbits. There are several structures visible in this image, but some of those will be discussed later on when we talk about facial bones. However, the occipital bone, with its prominent external occipital protuberance, is easily recognizable. Also, you can see the mastoid air cells are some very nice visual cues in helping you locate where you're actually at in this particular slice. The structures of the ear you will probably find the most challenging, simply because they're very small. In this CT axial image demonstrating the internal structures of the ear, you can find the label for the internal auditory canal at the very top of the image and follow the lead line to the structure on the interior of the image. The vestibule and one of the semicircular canals, both part of that inner ear and part of the equilibrium organs, as we talked about, are also visible. All of these structures are located under the protection of those very tough, thick petrous ridges of the temporal bone of the cranium.